deadly fungus that's resistant to antifungal drugs infects dozens of people in Louisiana, most in the New Orleans area.
Sabrina Wilson has more on what you need to know about the fungus that's spreading across the U.S. and who's most at risk of getting it.
Viruses, bacteria, and fungus are always around, but now one particular fungus has the medical community concerned. It's called Candida auris, or C. auris.
This passes typically in one of two ways, either person to person or contaminated surfaces that somebody touches and then they touch themselves, or the surface is contaminated and it's placed on the patient's body or individual's body, and that's how it's transmitted from person to person.
The Louisiana Department of Health says there are 50 known cases of the fungal infection in the state, and nationwide the infection is spreading at an alarming rate. It has a 30 to 60% fatality rate in the U.S.
It is high.
The majority of the reported 50 cases in Louisiana have been in the New Orleans area.
The symptoms really depend on where the infection is located. If it's a wound infection, it's going to be maybe some pus around the wound, but when it gets in the bloodstream, that's when people might develop fever, for example. They might get lightheaded. They might feel their heart racing.
But LSU Health New Orleans infectious diseases expert Dr. Fred Lopez says it's not time to panic.
People whose immune systems work well really don't need to worry too much about this fungus, but it is out there. It's worldwide.
LDH says healthcare transmission is responsible for most of the cases.
People who tend to get invasive infection with Candida auris, this yeast that we're hearing about increasingly, tend to be people who have many other medical problems. They might have tubes coming into their veins, or feeding tubes, or catheters in their bodies. They may be immunosuppressed for other reasons.
Oxner Health tells us it implemented all CDC recommended infection prevention and control measures to prevent outbreaks of fungal infections and already practices those mitigation efforts daily. Further, it says, in addition, we regularly educate our providers so that they can quickly identify C. auris in hospitalized patients. In the event a case is identified, we implement special precautions to stop its spread. All healthcare facilities in Louisiana work with the Louisiana Department of Health on tracing and surveillance of C. auris, a fungal infection that has been shown to be resistant to drugs.
It's usually resistant to one set of those antifungal drugs. The second set of antifungal drugs that we use, it's variably resistant to. And the third set, it's typically susceptible to. But we have seen cases where people have been treated with that third class of antifungal drugs, and that yeast has developed resistance to it, meaning that all three classes are ineffective in treating this infection.
Of course, hand washing is recommended since the fungus could be on surfaces. Now, some people have the fungus on their body but are asymptomatic. That's known as colonization. The fungus can be hard to detect in some labs because it may mimic other yeast infections, but Dr. Lopez says locally there are labs able to detect it. Liz?